I'm a third-year postgraduate from Maulana Azad Medical College, New Delhi. I'm here to present my topic, Setup for Laparoscopic Inguinal Hernia Repair. Introducing laparoscopic inguinal hernia repair for you guys. It offers a posterior approach to reinforce the abdominal wall. The principal laparoscopic methods which we are presently using are most commonly being total extraperitoneal repair, also commonly known as TEP, or transabdominal preperitoneal repair, TAPP, and the emerging new method of extended view, TEP. The hernia surge group currently recommends that laparoendoscopic techniques have faster recovery, lower chronic pain risk, and are cost effective, provided that resources and expertise are available. It is a preferred technique nowadays for any bilateral or recurrent inguinal hernia repair. The only absolute contraindication to it being the patient, being unfit for anesthesia, general anesthesia. Now, what is the importance of OT room setup? So the exact design and the setup of the operating room depends on the procedure which is being performed. Now, why is it important? A properly laid setup ensures patient safety and optimal patient outcome. It also maximizes the efficiency of the operating team, which includes the chief operating surgeon, the assistants, and the staff who scrubbed in. It also decreases any delay due to hazards due to inappropriate setup. It is very important initially, to begin with, it is very important to come to the OR sufficiently early to ensure proper setup and to ascertain that all instruments are available in good working condition. What all things are to be considered for the operative setup? We should consider as compared in an open surgery, the only thing which is to be considered is the position of the surgeon, being it on the left side or the right side of the patient, depending upon the pathology. But in laparoscopic surgery, we would like to take in consideration the optimal position of the operating team, which includes the surgeon, the assistant, and the staff nurse who's washed, the position of the patient, position of the monitor with respect to the operating table as well as the surgeon, and the equipment as well as instrument trolley. Coming to the most commonly performed repairs, which is TEP or TAPP, the patient positioning for both these repairs is almost the same. The patient is positioned supine on the operating table with both arms tucked by the side, which allows for adequate room for the surgeon and other assistants to stand. The monitor, as shown, is placed at the foot end of the table. The instrument trolley the instruments can be placed on a trolley beside the scrub nurse or can be placed on the Mayo stand over the legs of the patient. The basic instruments which are required for inguinal hernia repair are the telescope, the balloon dissector, atraumatic graspers, Maryland dissector, unipolar scissors, bipolar coagulator, and trocars. Now, as we can see in this picture, the operating surgeon stands on the opposite side of the hernia being operated, and the assistant stands on the side of the hernia to hold the camera. The scrub nurse will stand near the surgeon so that there is no delay in passing on the instruments. The cables which are used during a laparoscopic inguinal hernia repair are the gas insufflation tube, the camera cable with camera head, and the fiber optic cable. The cables are also known as the umbilical cords of technology. They should be handled very carefully. You should avoid unnecessary twisting or littering of the cables over the OT table. The fiber optic cable should never be placed over the patient when connected to the light source because any heat generated may cause burn injury to the patient. Demonstrating the right inguinal hernia repair in this patient. As you can see, The monitor is placed on the foot end of the patient over here. The instrument trolley, the electrosurgical unit, is displayed as such. The equipment trolley, which consists of the monitor, the video processor, the light source, and of course the gas insufflator. That is the instruments trolley, which is placed adjacent to the equipment trolley. And lastly, the electrosurgical unit. The cables should ideally be draped in plastic drapes and tied near the distal end to avoid any littering over the table. They are then fixed to the underlying drapes. This is the gas insufflator tube. The camera cable, and the light source cable, the fiber optic cable. As you can see that these are very nicely and neatly placed over the operating table, and there is no twisting of the wires seen. This is the camera cable being attached to the video processor. The light source being, the fiber optic cable being attached to the light source, and the gas insufflator tube to the gas insufflator. As you can see in this, that this being a right inguinal hernia repair, the surgeon is standing on the left side of the patient and the assistant on the right side with the scrub nurse scrubbed besides the surgeon. The setup for coming to the extended view TEP, which was introduced to overcome the limitations of TEP, it is based on the principle that the preperitoneal space can be reached from virtually anywhere on the anterior abdominal wall. The patient in this case is positioned supine on the table with the hands by the side. The difference being that the surgeon and the assistant, both the surgeons and the assistant are positioned opposite to the pathology, opposite to the hernia side. Lastly, coming to the ideal OT setup, which should be directed towards, so that there is less overcrowding or less clutter in the OR. There should be more space for the team to work and to move, as is required in case of bilateral hernia repairs, so as to ensure efficient performance. Ideally, there should be 2 mounted monitor screens, and the cables should be grounded or should be hanging through the ceiling so as to avoid littering over the floor. Lastly, but not the least, a huge problem can lurk in just neglecting one small detail, as we commonly tend to overlook the importance of operative setup. And with the operative room setup and design, the devil is in the details. Thank you.
I must say this was really a very beautiful presentation to cover everything.
Thank you, sir.
Do give our regards to Professor Parvinder Lal.
Sure, sir.
Any questions?